Prostate cancer. Prostate cancer is a serious health concern, but with knowledge and proactive steps, we can face it together. This video aims to provide you with essential information about prostate cancer, from understanding the risks to exploring treatment options. We hope to empower you with the knowledge you need to make informed decisions about your health. The prostate is a small gland, about the size of a walnut, located below the bladder in men. It produces fluid that nourishes and transports sperm. Understanding its function is key to understanding prostate cancer. Prostate cancer arises when abnormal cells in the prostate gland grow uncontrollably. Most cases are adenocarcinomas, originating in the glandular tissue. While many prostate cancers grow slowly, some can be aggressive and spread rapidly. Globally, over 1.4 million cases of prostate cancer are diagnosed annually. In Australia, it is the most commonly diagnosed cancer in men, with 25,487 new cases in 2023. In United States, there were an estimated 299,010 new cases and 35,250 deaths in 2024. The 5-year survival rate, Canada-Australia, is over 95% due to early detection efforts. Causes. Key contributing biological mechanisms include genetic mutations, for example, BRCA1, BRCA2, hormonal imbalances, particularly elevated testosterone and dihydrotestosterone, DHT, chronic inflammation in the prostate, oxidative stress, and cellular damage over time. Aging. Risk increases significantly after age 50, and most diagnoses occur in men over 65. Having a father or brother with prostate cancer doubles the risk. Hereditary prostate cancer accounts for about 5 to 10% of cases. African and Caribbean men have the highest risk and are more likely to develop aggressive prostate cancer. Asian men generally have lower risk, but risk increases if they move to Western countries. Mutations in genes like BRCA1, BRCA2, HOXB13, and Lynch syndrome genes increase risk. Genome-wide association studies have identified over 100 genetic loci linked to higher risk. Diets high in red meat, dairy, and saturated fats may increase risk. Low intake of fruits, vegetables, and fiber may also play a role. Obesity is linked with more aggressive disease. Smoking and excessive alcohol use may contribute to poorer outcomes. High levels of androgens, male sex hormones, like testosterone and DHT, are associated with increased risk. Men exposed to Agent Orange and certain pesticides have a higher risk. Possible occupational exposure in farming, rubber, and battery manufacturing industries. Physical inactivity is linked to worse prognosis and may increase risk of advanced prostate cancer. Prostate cancer is classified using the TNM staging system, tumor, node, metastasis, and Gleason score, which assesses aggressiveness. Stage 1. Cancer is small and confined to the prostate and is asymptomatic. It is detected incidentally or through elevated PSA levels. Stage 2. Tumor is larger but still confined to the prostate. Subdivided into 2A and 2B. PSA levels and Gleason score vary. Stage 3. Cancer has spread outside the prostate to nearby tissues, such as seminal vesicles, and there is a higher likelihood of recurrence. Stage 4. Cancer has spread to distant parts of the body, for example, bones, lymph nodes. Screening. In its early stages, prostate cancer may not cause any noticeable symptoms. This is why regular screening is so important. Talk to your doctor about prostate-specific antigen, PSA, testing, and digital rectal exams to determine the best screening plan for you. While prostate cancer cannot be completely prevented, certain lifestyle changes and risk management strategies can help reduce the risk. 1. Maintain a healthy diet. Eat plenty of fruits, vegetables, and whole grains and limit red meat, processed meats, and high-fat dairy products. Include foods rich in lycopene, for example, tomatoes, selenium, and vitamin E, which may offer protective effects. 2. Stay physically active. Regular exercise helps manage body weight and hormone levels. Aim for at least 150 minutes of moderate activity per week. 3. Maintain a healthy weight. Obesity is linked to more aggressive forms of prostate cancer. 4. Limit alcohol and avoid smoking. Reducing alcohol intake and quitting tobacco lowers the risk of many cancers, including prostate cancer. 5. Know your family history. Men with a family history may benefit from earlier screening and genetic counseling. Screening and diagnostic tests. 1. PSA, prostate-specific antigen. Blood test. It measures levels of PSA, a protein made by prostate. Normal range, generally considered 4.0 ng/ml, but age-specific ranges are used. Its limitation is that elevated PSA can also result from benign prostatic hyperplasia, BPH, prostatitis, or recent ejaculation, and false positives can lead to unnecessary biopsies. 2. Digital rectal exam, DRE. It is a test in which doctor examines the rectum to feel for irregularities in the prostate, like hard lumps or asymmetries that are not always found by PSA. 3. Risk-based screening. Recommended starting age is 50 plus for average risk, 45 for higher risk, for example, African descent, family history, 40 for very high risk, for example, multiple first-degree relatives with prostate cancer. Shared decision-making between patient and provider is encouraged to balance benefits and harms of screening. If PSA or DRE results are abnormal, further diagnostic procedures are performed. 1. Multiparametric MRI, MPMRI. Provides detailed images of the prostate. Helps guide biopsy and assess cancer risk. 2. Prostate biopsy. Truss-guided biopsy. Tissue samples are taken using ultrasound guidance. MRI-targeted biopsy. More accurate in identifying suspicious areas. 3. Gleason score. Grading system for prostate cancer aggressiveness, scale of 6 to 10. 6 means low grade, slow growing. 7 means intermediate. 8 to 10 means high grade, likely to spread. 4. Additional biomarker tests when needed. PHI, Prostate Health Index. 4 CAS-score or PCA3 urine test to refine risk assessment. Once prostate cancer is confirmed, then imaging tests like CT, bone scan, or PSMA PET scan help determine the stage and spread. TNM, tumor node metastasis, classification is used to guide treatment planning. Treatment depends on the stage, grade, PSA level, age, and overall health of the patient. Active surveillance, for low-risk or slow-growing cancer. Involves regular PSA testing, DAREs, and biopsies. Surgical treatment includes radical prostatectomy for removal of the prostate gland, can be open, laparoscopic, or robotic. Radiation therapy, external beam radiation therapy, EBRT. Brachytherapy, internal radiation seeds. Hormone therapy, androgen deprivation therapy. Reduces testosterone levels to slow cancer growth, often used for advanced or high-risk cases. Chemotherapy is used for metastatic or hormone-resistant prostate cancer. Common agents includes docetaxel, cabazitaxel. Targeted therapy and immunotherapy like PARP inhibitors for BRCA-mutated cancers. Immunotherapy, for example, Sipuleucel-T, used in selected cases. Other emerging therapies includes PSMA-targeted radioligand therapy, AI-assisted diagnostics, and non-invasive testing are under development. Prostate cancer has one of the highest survival rates if detected early. Localized, stages 1-2, nearly 100% 5-year survival rate. Regional, stage 3, still almost 100% survival rate. Distant, stage 4, drops to around 30% 5-year survival. Early detection and timely intervention are key to better outcomes. A prostate cancer diagnosis can be overwhelming, but remember, you are not alone. Support groups, counseling, and open communication with your healthcare team can help you navigate the challenges and maintain a good quality of life. Many men live long and fulfilling lives after a prostate cancer diagnosis. Ongoing research is crucial for improving our understanding of prostate cancer and developing more effective treatments. By supporting research initiatives, we can contribute to a future where prostate cancer is even more manageable and curable. Your involvement can make a real difference. While prostate cancer is a serious disease, advancements in detection and treatment are constantly improving outcomes. With awareness, early detection, and access to quality care, we can continue to make progress in the fight against prostate cancer. Stay informed, stay proactive, and stay hopeful.